From 2020 Nobel Laureate in Medicine, Harvey. He was with us last year. He was planning to come, but he went to hospital for a virus, a very strange virus, and then he just got out of the hospital, and he was feeling weak. Now he's good, by the way. Just to give you an example, we gave him 2 NDs, and his power, his energy went up from very weak to very, now it is in a normal condition, just because it was at the last moment. So last night, we recorded his presentation. Not last night, previous night. Last night we were in the phone party. In the previous night, we recorded his presentation. Now he's feeling very good. By the way, Haruki, you didn't hear this. He told me that he's feeling now like before. After taking the 2 NDs, his energy went up. And just because it was not enough time to come here, we recorded his presentation just the day before yesterday. But he is feeling perfect now. Okay, so Harvey Alter, it's a very, very interesting presentation. Very interesting. You will see plagues, viruses, vaccines, anti-vaxxers. Which will be the victor? Please, it is a recorded lecture. We recorded just in the evening before last night.
Dr. Alter, it's an honor and pleasure being with you again. You know that you are one of our highlight of SIPS 2024, and I'm pretty sure you'll be in 2025, although virtually, and I do not doubt that. I'm really glad you are in a good shape as always, and I'm looking really forward to this presentation to be shown to all our attendees, although virtually and recorded, but still, I do not doubt its quality and its significance.
Thank you, Florian. It's a real pleasure to be here. I wish I was in the Philippines, but health did not allow that. Thank you very much, Florian. A pleasure to be presenting again at SIPS. The title of my talk is complex, but that's what I'm going to try to cover. This is a picture of a painting by Bruegel depicting the plagues, which he called the triumph of death. It's a incredible painting, very morbid, but depicts the devastation of the plagues. We've had many ancient plagues. They actually been recognized since 430 BC, all the way through the 19th century. The Black Death is the most famous in the 14th century. It arose in Central Asia, spread by the trade routes, reached Europe in 1347, and then spread back through Asia and all the way to Africa. It was caused by Yersinia pestis, a bacterium, used to be called Pasteurella pestis. It's transmitted by fleas, and the fleas are carried by rats. And that was the cause, the unsanitary conditions in those times. It was characterized by fever, chills, weakness, pneumonia, and very painful swollen lymph nodes that were called buboes, and hence the term bubonic plague. Estimated death toll was 75 to 200 million. It's estimated that a third to a half of Europeans died. It began actually the practice of masking and quarantining as the first crude measures to prevent transmissions. Now we have the epidemics and pandemics of the 20th and 21st century, beginning with Spanish flu in 1918, 1919. The cause of this was the H1N1 influenza virus. This virus, too, infected about a third of the world. with 50 to 100 million deaths. It was spread by troop movements. Actually, Spanish flu was not the right term for this, because it actually began in Kansas in the US, where an infected soldier was then shipped over to Spain and began the epidemic in Spain. It then spread throughout the world. The next was the Asian flu of 1957-58. This was a variant of the flu virus, the H2N2 influenza virus, influenza A virus. It caused 1 to 2 million deaths worldwide. This also originated in Asia and then spread globally. In 1981, we had HIV/AIDS, which I'm going to talk about in more detail later. But this has caused about 36 million deaths, and there are millions now living with HIV but controlled by drugs. And it mutated. HIV came to us from simian viruses in Africa. And I'll show you that. Then in 2002, 2003, we had SARS, severe acute respiratory syndrome. This infected a relatively small number compared to the others, only 8,000 people with 800 deaths. But it began in Asia, and it was the precursor to COVID-19. In 2009-10, we had the H1N1 influenza virus come back and was better contained this time, but still caused up to over 500,000 deaths in the very first year. The swine flu virus originated in pigs, hence its name, and a vaccine was developed that helped control it. Ebola is one of the most frightening infections ever. It's almost universally fatal. It's limited in its deaths. It's been limited to West Africa, but there have been recurrent episodes, the most recent in 2014-16. But the mortality rate is very high and the death is very gruesome. There's no treatment for it. This is a picture of intimate contact in the time of COVID. COVID is all in our recent memories. It began in 2019. It was a mutant of the original SARS-CoV-1 virus, now called CoV-2. There have been 700 million cases and 6.8 million deaths worldwide. The World Health Organization has declared it a pandemic. It began in Wuhan, China. A lot of controversy as to whether this escaped from a lab or was spread from the animal market. To my mind, it doesn't matter where it came from. It wasn't purposely put out there, and it did begin in Wuhan, and it did spread throughout the world. It led to global lockdowns, masking, hospitals were overwhelmed. We went into remote work. There was a global recession, all due to this COVID-19 virus. But fortunately, there was a very rapid development of new type of vaccine, these messenger RNA vaccines that were very effective. But it also began the anti-vaccination movement that we'll talk about. Still, there are emergence of variants caused by surges, a very highly transmissible agent, and there is some vaccine resistance. We're now considering an endemic disease requiring annual vaccinations. I want to jump to HIV. HIV began in Africa in simians, in monkeys of various types. It was a virus called a simian immunodeficiency virus. It was non-pathogenic in the chimp, but the chimp was the intermediary route to the humans. It entered the humans surprisingly as early as 1930, maybe as early as 1915. But it didn't cause much effect in humans at that time. But the crossover to humans was related to hunting and butchering of infected chimpanzees. So the chimp was infected, but not sick. They were butchered, they were eaten, their blood got over people, and it became a public health crisis in the mid-1980s. There have been 60 million infections worldwide in more than 150 countries on 6 continents. Greater than 20 million deaths to date. 33 million people are now living with HIV, 22 of those million in sub-Saharan Africa, 4 million in Southeast Asia, but many in Europe and the US as well. Estimated 2.5 million new infections annually. Most infections now are transmitted heterosexually with equal spread to males and females. HIV is a very complex and interesting virus. Shown in the center here is the life cycle of the virus. The virus has a surface antigen called GP120. This attaches to the CD4 T cells through a CCR5 linker receptor. It comes into the cell as an RNA virus, but it's reverse transcribed into DNA and then integrates into the nucleus. And in the nucleus, it can then code for HIV proteins, HIV RNA genomes, which then merge into the final infectious particle, which is extruded from the cell and causing a new cycle of infections. The replication rate of HIV is enormous, 10 to the 9 variants a day. So 1 billion viruses are produced every day. There's an incredibly high mutation rate and recombination rate. And hence a very difficult virus to control. But then, I'll get back to that in a minute. There were 2 kinds of outcomes shown in the chimp. The pigtailed macaque is the model for humans. Shown in the yellow line is the P24 antigen, a measure of the virus. You see there's a high level of virus at the beginning of infection. And then it causes a decline in the CD4 helper T cells, eventually over many months, resulting in severe CD4 depletion and a systemic immune deficiency. In contrast, the African green monkey gets similarly infected, but does not cause a decline in the CD4 cells, and you do not have disease. Fortunately, highly active antiretroviral therapy came along, directed at that reverse transcription step in the life cycle. Shown here in yellow are the number of patients who are now on heart therapy, and shown in purple is a decline of the virus over time, beginning in 1998, 99. Hence, we now have people who are infected, many infected, but who not go on to CD4 depletion. The virus is controlled at low levels, and we now have a sort of endemic state of HIV. I want to jump now from viruses to vector-borne agents. These have been a big problem throughout the world as well. We have tick-borne diseases shown in the upper left that cause Lyme disease by transmitting Borrelia. They transmit Babesia and Ehrlichia. These are sort of now major infections in certain parts of the US and other parts of the world. We have Chagas disease caused by Trypanosoma cruzi. This is transmitted by a reduvid bug that lives in thatched huts, drops its feces on people sleeping on the floors of these huts, and they get infected and get Chagas disease. But I want to concentrate now on mosquito-borne viruses. Mosquitoes are a really major global threat. They cause innumerable cases of malaria. They cause West Nile virus infections. They cause dengue infections. They cause a variety of equine encephalitis viruses. And the reason is that the mosquito, what is a mosquito? Mosquito is nothing more than a flying syringe. These mosquitoes just suck up blood and transmit it through the proboscis. Here's a picture of a mosquito before biting somebody, and a mosquito now engorged by blood, which they would take from one person to the next. Malaria is really a bad disease. It's caused hundreds of millions of cases globally, most of these in sub-Saharan African children. It's a major cause of fetal childhood mortality in Africa. In just 2020, there are estimated to be 627,000 deaths from malaria, again, mostly in Africa. We've made great progress with insecticides, with treated beds, with nets over the beds, with spraying, but mosquitoes are becoming resistant to these insecticides, and the disease continues. There's been a recent vaccine called Mosquirix, which is a major advance in the malaria prevention. But now we're in a state where COVID set back the whole malaria prevention scheme. And now the US has cut off aid to African programs. So now HIV and malaria can progress in Africa just because we're not supporting these poor countries. It's a real tragedy. West Nile virus was an interesting virus that came to the US. It's an RNA flavivirus, again, spread by mosquitoes. And there's a cycle. Mosquitoes bite somebody, give them West Nile virus, then another mosquito bites them and transmits it to somebody else. Most cases of West Nile are really asymptomatic, but 20% develop fever and a kind of a flu-like syndrome. But 1% have a severe neurologic disease causing meningitis, encephalitis, coma, paralysis. And it's shown that the virus can infect the anterior horn cells of the spinal cord, very similar to polio. This is maps of the beginning epidemic in the US. It first came to the US in 1999 in New York State, shown in red. Red is the human infections, yellow are the bird infections, because West Nile virus host is the bird. And birds were dying. We could see black crows lying on the streets here in the US. But in 1999, it was sort of contained to New York State. By 2000, it was beginning to spread. The birds were dying, going down south from New York. A few human cases were moving south. By 2001, they moved from New York to Virginia to other states, was beginning to hit the Carolinas. It was already jumped to Florida due to mosquito transmission to parts of Texas. By 2002, it infected virtually the whole country. Birds had died everywhere. They were now going into the West Coast. So it was a dramatic spread of a virus over a 3-year period. William Murphy, talking about transfusion-transmitted West Nile virus, had this interesting comment. He said, blood transfusion has features that are characteristic of complex systems, and is sensitive to major effects from small, remote perturbations. Witness the origins of HIB, bovine spongiform encephalopathy, that's mad cow disease, or the consequences of transmission in the United States of the arrival in New York of what was possibly a single West Nile virus infected mosquito. Interesting, might have come from an airplane and then spread throughout the whole country. Dengue is another one of these very prevalent now flavivirus infections. It's not carried by snakes as shown in this picture, but it's endemic in Southeast Asia, the Americas, particularly Puerto Rico and South America, but also in the Western Pacific and Africa. It's mosquito-borne flavivirus, 100 million cases of dengue fever annually, about 250,000 cases of dengue hemorrhagic fever, the severe form of dengue, and 25,000 deaths annually in over 100 countries. Humans are infected by the bite of mosquito, and as I said, mosquitoes can then be infected by biting other humans. It was a real problem here in Puerto Rico and southern United States, still is a problem. The first infection you get with dengue is generally mild, but when you get reinfected, rebitten, you get this very severe dengue hemorrhagic fever, characterized by bleeding, shock, and often death. There is now a recently described dengue vaccine. Is restricted so far to people who've already had dengue, and then to prevent this more dangerous second infection. This is the distribution of dengue. You can see it's a sort of an equatorial virus, particularly in South America, Southern Africa, and into Southeast Asia. And just to skip away from infectious diseases, I wanted to tell you a little study I did to evidence of the chances of a man winning an argument at various times during his relationship. Now, when you're dating, you have about a 50% chance of winning an argument. Once you're engaged, it goes down to about 25%. And once you're married, you have no chance of winning an argument. I have great experimental proof of this. We're now into this anti-vaccination movement. This is something terrible that's happening in the US. I don't know if it's spreading to Europe. But Robert Kennedy Jr. has associated vaccination with autism, with no scientific evidence. Indeed, there have been many studies that have debunked this notion. Nonetheless, with no scientific evidence, Robert F. Kennedy Jr. and President Trump have advised against COVID vaccination. After that, almost all COVID deaths were among the unvaccinated. In 2019, RFK Jr. visited Samoa, and he spoke about measles vaccination, which had been traditional in Samoa. He talked against vaccination. This was followed by one of the largest measles outbreaks in the world. He's now talking about not taking the burst dose of hepatitis B vaccine. This is a study done back in 1983 by Palmer Beasley in Taiwan, showing that if your mother is hepatitis B infected and you don't get anything, you have a 90% chance of becoming a lifelong carrier of the hepatitis B virus and going on to develop chronic liver disease and liver cancer and liver-related death. They started to give a hepatitis B immune globulin to these children at the time of birth. And when they gave 3 doses, the rates of transmission went down to 23%. When they used the early vaccines, the rates also went down to 23% if you gave it within the first week of birth. And if you gave both the vaccine and the immunoglobulin, the risk went to 5%, down from 90%. In studies also done in Taiwan, they've shown that when a universal vaccine program for newborn infants was instituted in 1991, where the rates prior to that were 20% in males, by 2001, it went down to 4.9%. And females went down, and females vaccinated at birth went down from 14.3% to 2.4%. In a separate study shown on your right, where they tested the rate of hepatitis B among people who were less than age 15, that was the cohort that was vaccinated at birth. The prevalence of hepatitis B was only 0.7%, whereas those who were older than 15 who did not get vaccinated, the prevalence was 21%. It is also shown the effectiveness of this vaccine in various ways. The hepatitis B surface antigen, the marker of hepatitis B, went down by 78 to 87% in Taiwan. Mortality from fulminant hepatitis in infants went down 68%. Hepatocellular carcinoma, HCC, in children went down 75%. So birth dose vaccination is a proven, highly effective, highly important vaccine. Yet they're now talking that we shouldn't get it. Shown here is my estimation of deaths. It's a relative deaths or serious adverse events that can actually be related to a vaccine. Very low. These are deaths due to Robert F. Kennedy Jr. He's going to be responsible for hundreds of thousands, perhaps millions of deaths by denying, talking people out of taking common vaccines that have a long history of effectiveness. That includes the measles vaccine, the mumps vaccine, the rubella vaccine, tetanus, diphtheria, pertussis, which is whooping cough, and hepatitis B. Those are all children, standard children vaccinations that now parents are afraid to take because of this false assumption that it might cause autism. In adults, it's also hepatitis B vaccine, but also papillomavirus, which prevents cancer, cervical cancers, a great vaccine, the COVID vaccines, the flu vaccines, all highly effective and now not being given. I'm calling this now not the Black Plague, but this is the RFK and Donald Trump Orange Plague, named after Trump, who supported these terrible, terrible public health measures. I don't know how this is going to play out, but it's not going to be good. For myself, I find that old age comes at a bad time. But I think that senility will be a fairly smooth transition for me. And I just want to end by saying that I'm so sorry I'm not hanging out with you in the Philippines. I know it'll be another great SIPS meeting, and I'm very, very sorry that I'm not there joining you. Thank you very much.
Thank you very much, Dr. Alter. As always, you are on the top of everything. And in this very, seriously, I mean it, in this very important subject. And I didn't doubt that your presentation would have been good. And you are good on top of everything else. And you are, giving a very important message. So everything, any decision has to be based on data and on scientific studies. Although sometimes the impressions might be good, might not be always true. So again, we really appreciate your input. You are always welcomed. And I don't think there is a senility phase for you. I'm pretty sure I mean that. So here, this is recorded, and this is recorded, and I will keep it as a commitment. You'll never have senility.
Okay. Thank you, Florian. Thank you so much.
Yeah. Thank you
Have a
again.
great,
And
have a great meeting.
next year, 1 year younger, you'll be in Rio de Janeiro or in Cartagena, Colombia. We're going to decide sometimes in November.
Okay.
Thank
Thank
you
you.
very much. Thank you again.
Bye.
It's a
Bye-bye.
pleasure.
Bye.